friends, welcome to Smile Nursing tutorial. Last time we have discussed about the oral contraceptive pills. Today we are going to speak about the stages of labor, which is very important topic. Coming to this, we have 4 stages. One is first stage, second stage, third stage and fourth stage. Now we will see the first stage. First stage, when it begins, the onset of labor pain to the full dilatation of the cervix, that is 10 centimeter dilatation. In the primary it takes 12 hours and in multigravida it takes 6 to 8 hours. Okay, in this again we will see the 2 stages. One is latent stage, second is active stage. That everybody knows. What is latent phase? That means less than 4 centimeter cervical dilatation. At that time we should not start the patograph. Okay, contractions weak. That means less than 2 contractions in 10 minutes. Coming to the active stage. That also just we will let you know. Okay, what is active phase? Cervical dilatation is 4 centimeter. So that time we have to start the patograph. Okay, coming to the second stage. Coming to the second stage, this is the period from full dilatation of the cervix to the delivery of the baby. Actually, this second stage in the primary it takes 2 hours. In multigravida it takes half an hour. Okay, in the middle of the topic, every time we have one proverb. Today also we have, that is, all good things must come to an end. It is reality. Next, third stage, it starts after delivery of the baby to delivery of the placenta. Actually, it takes about 15 to half an hour, whether it is a primigravida or multigravida. Next, fourth stage, it starts first 2 hours after delivery of the placenta. Actually, it is a critical condition. Why? Because sometimes she may develop PPH or any fetal complications in this period. So, we should be very careful. Today, we have discussed about 4 stages of labor. If you like, subscribe for new updates. Thank you for watching this video.